Tiger Woods' new injuries are added to his back problems. The golfer had his 5th back surgery just this past December. So joining us now to talk more about what doctors may be dealing with is Dr. Brian Cole, who's a prominent orthopedic surgeon at Midwest Orthopedics at Rush. Thank you for giving us the time, Dr. Cole. I want to know your perspective on this because we hear this and we say, okay, multiple fractures, you've got rod and screws and you've got tissue damage. So I think to the layperson, it sounds really devastating. To a seasoned surgeon, what are your thoughts?
Well, it's, I think what you're hearing is that it actually is a very, very challenging problem. Often we talk about fractures or breaks in the bone, but the reality is this is also a significant soft tissue injury. And that's as complicated as just having the fracture itself. So he had what we call a comminuted or segmental tibia fracture. So that's a very difficult fracture to manage itself. That was rotted. He had a hindfoot injury and maybe a midfoot injury, which even in isolation, those are profoundly difficult injuries to manage. It is not uncommon that the nature of these injuries, given the soft tissue envelope around the bone, could even lead to an amputation in some instances. Fortunately, that wasn't the case here. So what we know is it was a very complex right lower extremity injury, and it's not just the bone that was presumably fixed as by reports, but it's also the soft tissue that has to heal properly, hopefully prevent or revert infection, and to get him back on his feet again.
And I know when we spoke earlier, that's one of your biggest concerns is the infection moving forward.
Yeah, I would tell you that, these injuries are catastrophic. They're not like on the field injuries where someone has a tibia fracture and so forth, but they're like injuries that they're dirty wounds often. In other words, it happens out in an open place. They're potentially contaminated, and we worry about infection compromising healing of the bone, but also compromising healing of the soft tissue. And sometimes it requires multiple surgeries to get the soft tissue closed and so forth, because I know we also had a fasciotomy done, which is where we open up the soft tissue around the muscle compartment in an effort to alleviate pressure that could otherwise compromise the blood supply and or the neurovascular structures.
All right, let's talk about rehab, especially timing. This is someone we've seen come back from so much before. He's had knee surgeries, he had 5 back surgeries, but are those going to impact his rehab now?
In isolation, this is a tough injury to recover from, and I know everyone will be asking the question, will he ever play golf again? I think the thing that we should focus on and hope for is that he has a pain-free existence with normal gait, normal function, just because of the nature of the injury itself, especially to the hindfoot. As far as the rehab goes, it's going to be a prolonged period of non-weight bearing, most likely. That causes muscle atrophy and disuse. Clearly, his back history might contribute, and what we don't know is what have been the contributions of this initial injury right now to aggravating his back or other things. We've only heard about the right lower extremity, but suffice it to say there could be other things that were involved as well, but not to the level of severity. So as a composite, having a low back problem in the past added on to this very, very challenging injury to recover from, it's not going to be an easy go out of the gates for him, despite being an elite athlete.
You've worked with so many elite athletes before. I know the Bulls and the Sox, even Joffrey Ballet. Can you talk about how that might help in terms of rehab? I mean, the focus for people, the muscle tone on the rest of their body?
Yeah, I think certainly being fit, and golf is a active sport, and I think people underestimate the level of fitness that our elite golfers have, and also having the perseverance and the intelligence to manage and rehab injuries. He has that, and the other issue is the fact that he has the resources around him to get him rehabilitated properly. So when you add all that up, he's also getting excellent medical care. He's an amazing medical institution in Los Angeles. So when you add all of that up, if anyone can do well, Tiger Woods can do well after an injury as catastrophic as it is.
Some good news, but it's going to be a long haul. Dr. Brian Cole from Midwest Orthopedics, thank you so much for your insight today.
Thank you. Have a nice day. Bye-bye now.